As a follow-up to what we've been talking about, is just have Dr. Brian Smedley come. Dr. Brian Smedley is the co-founder and executive director of the National Collaborative for Health Equity. That project connects research, policy, analysis, and communications with on-the-ground activism to advance health equity. He's going to help us process all the information that we've heard today, because what we want to do now is to really start looking forward. We heard about where we are. We heard about some of the state of community activism that's going on so far. We've heard about some really promising interventions. But now we want to start to put it all together and really start to come up with solutions to some of the health disparities that we're seeing in our communities, many of them due to access to care and other inequities. And so Dr. Smedley is going to help us guide our thought processes and discussion as we wrap up today. Dr. Smedley.
Well, good afternoon, and thanks to those of you who've stayed. You're some hearty souls. We appreciate that. Today has been very powerful. What an amazing set of speakers and issues that surfaced today. So first, we should thank the conference organizers. I want to particularly thank the staff here at the American Psychological Association, but also, of course, OMH, Dr. Gracia and her staff, SAMHSA, and of course, Acacia Bamberg-Salati and the Partnership Center. Thank you for organizing this very, very important conference. I'm very moved and inspired by what I heard, and we want to use this time for you all to share your thoughts as well. Some of the key themes that I heard are important for us going forward, because obviously there are some uncertain times ahead. But we heard about sources of strength and resilience in our communities. We heard about people responding to needs, not waiting for somebody else to step in. I'm pretty sure Bob Fairchild and the Omegas will continue their good work regardless of what the coming days bring for us. I'm pretty sure Ollie Smith will continue his work. These are homegrown solutions to needs that leaders in these communities saw, and they stepped up to the challenge to do that. But we're, of course, also dealing with a time when we need to be very clear about the risks to the mental health and well-being, particularly of marginalized communities. And so I heard some things here today that give me encouragement about the possibility, not just the possibility, the fact that we are coming together as many communities to do the battles that we know are coming up. So we know that as communities of color and LGBT communities, people with different ability status, people who practice different religions, as we come together to fight against the forces of bigotry and expressions of hate that have come out in these last few weeks and months, that we will win. You know, we've had some setbacks, but I'm convinced, hearing the speakers and hearing the comments from the audience, that we are our best allies, coming together with strength and resolve to challenge the attacks that many of our communities will no doubt face. And let's be very clear, those attacks are determinants of health. They're determinants of health and well-being. So to allow racism, xenophobia, sexism to persist, even just being in the air, it didn't even matter if it results in policy change, just being in the air in our culture, we have to eradicate that, because that is a risk to our health, mental health, and well-being. So again, I'm just very thankful and appreciative of this space and this time to learn from leaders like you and to share strategies. If you're like me, you also like to know what's next. How do we come together? How do we roll up our sleeves and work together to address our needs going forward? Some of our solutions will be homegrown, because it may be that we can't turn to the federal government, at least in the short term, for solutions. But we have some solutions in our own communities that we can certainly turn to. But then, importantly, how do we come together? How do we build a bigger movement against the marginalization, the exploitation of people, and the hatred, the intolerance that we've seen? I know you all have some ideas, so that's what we want to hear. So I'm going to turn the mic over, so to speak, and hope that those of you who have some thoughts that you'd like to process will feel free to share those thoughts. We're going to try to do this quickly and efficiently because yes, please.
Earlier, I wanted to make this comment, but it was just prior to lunch. And I wanted to make certain that I had ample time because, to be very honest, we've got to go, a term that I am accustomed to using and hearing, to the exact nature. And when I'm talking about that, I'm talking about our children. The Carolyn Ann Foundation, of which I'm president, that's our focus. We know, I've heard that people become symptomatic when they're in secondary schools, et cetera. No, you've missed the boat by then if you're thinking that the symptoms you're seeing at that point just begun there. We're talking about our children who are in traumatic environments, and by the time they are attempting to deal with what's going on in their environment internally, and then they come out and are externally exposed to all of the other layers of trauma. So we have found at the Carolyn Ann Foundation that we have a location, but you can't always wait for someone to come to the mountains. The mountain has to go to them. So we are faced with some challenges because right now, Senator Ryan and his associates are looking at ways today that they will continue their efforts, which started on November the 9th, to strip away at the Affordable Care Act. I do information and referral, a program I direct. I have had so many phone calls from individuals, and these are people in the community who are at a point where they are in total despair. I talked to a woman for 45 minutes from Minnesota, contemplating suicide. She had just found someone to address her mental health needs after searching, not being able to afford it, being turned away, just gotten the benefit, just gotten into the care of someone, and they told her the other day that they may have to refer her somewhere else, meaning that, I'm sorry, I can't give you the services any longer, and I don't know if you're going to be able to get them. So when I'm talking about our children, because we know a broken child becomes a broken adult. So the work that we do with children, it's going out there. Your community centers, we're working with churches, because believe it or not, the experience that I had, and I'm from a family where mental health issues are intergenerational. Someone else has said that. And we do know that we've got people with some weird attitudes. And we're not talking about just stigma. We're talking about those who don't understand the importance of words and how they're used, particularly when you're directing them toward our children. So I guess I'm saying to you, if we're not getting people to come to us, we've got to get out there and get to them, especially when it comes to our children, because they're so vulnerable and they don't know that we care. Thank you.
Thank you for that. Others? Okay, come on. Mike over here.
How you doing? My name is Bruce Purnell with Higher Hopes, now becoming Love More. One thing that I believe that we need is a unified platform. I work throughout the DMV with the most vulnerable populations, and the young people, they don't know why. They don't understand their purpose. What are we fighting for? At one point, it was liberation throughout the continuum of time. And is that what it is? Are we helping to help those who can assimilate, or are we breaking the status quo? If it is about dismantling the status quo, then our young people need to see us fighting for it. And sometimes it's very murky, as, you know, are we teaching compliance, or are we teaching the young people to have an active voice?
Thank you for that. Another comment?
It's just a comment. I wanted to, as the gentleman spoke and then you talked about hearing from us, I just remembered this statement I read in Eckhart Tolle's book. I can't remember which one, A New Heaven or the other one, where he mentions whatever we fight, we will strengthen, and whatever we resist will persist. Personally, I know that to be the case here in D.C. And I would like to, I don't know whether, I would like to suggest we find another term to use instead of fight, because in this uncertain environment, for some of us, fighting is our natural stance, and it hasn't served us well. So maybe we could think about another term to replace whatever this movement or whatever the outcome of this discussion will be. Thank you.
Excellent suggestion. It could start with love.
Good afternoon. I wanted to just echo Dr. Purnell's statements about, are we teaching compliance and assimilation? I work with some of the same youth that he works with, and I listen. Oftentimes we seem like we're very siloed in our approach to bringing about change. And I work in different spaces, and oftentimes when I come to these, like this conference is amazing, but how do we get this message out of here into the communities that need it the most? So we'll walk away with this information and we go back to our spaces, but how do we work, honestly, together? And how do we have those difficult conversations? Because I think a lot of us, after November 9th, people were very frustrated and they were angry for a day or two, and then we went back to wanting to be, some folks, to being entertained. Again, like being distracted and saying, okay, well, it's not here right now. I don't know what tomorrow's going to bring, but we have to start planning for what tomorrow brings instead of waiting for tomorrow. And so just going back to what he was saying, how do we have those difficult conversations and we don't teach compliance, but how do you teach independent thinking? How do you teach people to have a voice and for that voice to be respected and to respect other voices and opinions? So.
Yes, excellent. And I hear you saying, let's create the future that we prefer.
I think I wanted to piggyback on what the sister said in the back about the words that we use. I have intentionally lived in very tough inner city communities out of choice, and to get to know the people there, to let them know that I love them, we had a love affair. One of the things that I heard over the years was people are tired of fighting. They want to know, what are we for? How can I be helped? Not what am I fighting against? Because we've sent them the message so long that nothing's going to change anyway until white people change. And they're feeling, they tell me, white people not going to change, so why bother? So the message has to be a positive one for you, for us. What are we doing? What are we doing here that will change for us? And I saw tremendous change because they had a sense of vision and hope then, and that's very important. The other point I wanted to make was, of course, we are upset about the outcome of the elections. And we have to do what we're talking about doing in this room, but I think the other part we have to do is to become involved with the leadership of this administration in some way. If we back off, how will they know our needs? And everybody is not evil and crazy, and they want to know. I don't care what we think, because I've worked in some capacity in presidential administration since Jimmy Carter. I know how these things work. Don't throw this administration away. Nothing is too big to change. And that's the message that I have. I've seen it. Some of us have got to take some light. Okay? That's it.
Thank you. Thank you for that. Keisha?
Thanks, Brian. You know, when Tiffany and I started having this conversation, one of the things that I said was that I want to have an accessible conversation. Because I think for a lot of times when we're talking about mental health, behavioral health, equity, as people have said, it does get siloed. And I told her, I said, I want to make it sexy. I want to make it something where people are interested in hearing about it. And it's one of the reasons why Mr. David Johns is here, because I know that nobody does sexy better than, David Johns. But the idea about this is that we've been having, in terms of social media, in terms of pop culture, we've got all of these great examples. Kid Cudi was talked about, the issues that have been happening with Kanye West, Jay Farrow, who is also talked about from SNL, who's talked about his issues with mental health. And there's a lot of people talking about the hashtag #YouGoodMan. My question is to piggyback on what other people have been saying. All right, this conversation is happening in here. How do we take it outside? But also, how do we kind of take advantage of the zeitgeist? I mean, Insecure on HBO a couple of weeks ago had these types of conversations. So it's percolating up in the public consciousness of not just people like us ourselves, but millennials. How do we make sure that we're using these different types of catalysts and these different types of messaging to get that message forward?
Thank you.
I want to thank you for this gathering, and I want to bring a different perspective as a pastor of almost 50 years, so I'm old. I would like to see more discussion to kind of expand it. I'm here only because of the grace of God. To explain. I'm wondering what the data is. It's mentioned about the suicide rate when it comes to African American males, but there's another group that's very closed that need to be looked at and expanded, because this particular group also deals with a large segment of society, and they are black pastors. Where the suicide rate, substance abuse rate is on the rise, and suffering a lot of dysfunction. It's not taught in our seminaries how to deal with it. And first responders, and how do we address this? We don't really talk to each other. Our circle is very small. So how do we tackle this going forward? Now, I travel the globe because this is one of my issues that I'm really concerned about.
Thank you for elevating that. I see some other hands.
Yes, I got an answer.
There's also somebody behind you who's got a mic.
Let her go.
Oh, okay.
I just want to give some answers, because it's amazing. Sometimes we overthink things. We make things so complex. For instance, in my community, there are 3 churches. There's a civic association meeting. There is a community center. There is, let's see here. I'm thinking of this homeowners association, but they have a place where they do socials, etc. I've gone to each one of those places and said, listen, what will it take for you to let me have a meeting here, a meeting about mental health, a meeting about mental health and how it impacts our children? PTAs, it's not that hard. What may be difficult is getting your foot in the door. But I've been amazed sometimes at the reception, and particularly after you do it, when they're coming back to ask you to do more. So it's not that hard. What is hard, though, is to sometimes get out of our comfort zones, getting and thinking out of the box, and then taking action.
My name is Carol Josephowski, again from the ELCA, and one of the things I thought might be helpful was sharing a project that occurs in urban contexts in Chicago in particular. It's called Assets-Based Community Organizing, and recognizing the assets in community, not just those with finances, but those who have property, those who are servicing, and bringing those folks together at one table, but not just the people providing service and the administrators, but the persons who are recipients of services. That when you bring these persons together at the same table and are in conversation and discerning together what programs are happening, what things are working, where can I not duplicate what you're doing or compete with what you're doing, but complement what you're doing? And that this is one of the inefficiencies that touch on ways that we could be growing and doing better. So I want to offer community-based or asset-based community organizing as one method. And as Cheryl was talking, it reminded me, those organizations can be nonprofit agencies, but do not, I used to work in banking, do not leave out the partners who make money and who are wealthy, because they do have concerns. And I expressed this to one person today. Even though in this economy, in the change of elections, tradition or stats tell us that when there is a Republican and wealthy environment, what happens is government is doing less of the funding and private foundations and donors step up. And so we have to remain encouraged by the fact that sometimes the government money is going to privatize businesses doing what nonprofits do well. And we need to support the fact that there are those who need to be at the table, even if they disagree or we don't agree on everything, that they are our donors. Those are the forms of relationships we need to be able to build in protective and careful ways, but we need to build those relationships to build donor bases and memberships.
Thank you.
Thank you. I'm Samir Ahmed from the Family Youth Institute. Much of the discussion we've had about the barriers that we face for the communities that we voice their issues and challenges. One of the things that was mentioned earlier was the need for mentoring. And it was in the context of mentoring students. But I think part of what we also need to do as organizations or activists who are really trying to meet the needs of our community is mentor each other. Help identify resources or opportunities that may help us grow and increase our ability to have that impact that we're looking for. So that would be something I'd encourage you, if you see people or programs or opportunities, to contact each other and say, hey, this is a great opportunity, why don't you try it? Because oftentimes, many of us are trying to do too much work with very little resources and very little funding. And knowing that someone else is there on your side and advocating for your behalf really helps to strengthen the alliance.
Okay. Good afternoon. My name is Shannon Tate, and I work for SAMHSA, and I also do work outside of SAMHSA, and I wanted to respond to the pastor. I am a mental health first aid trainer and really wanted to talk to you specifically because of the work that you said about being first responders and what do pastors do. And because of the trainings that I've done with churches around mental health first aid, I got calls back about how can you help us heal ourselves? So I put together a training called Healing the Healers. And I've been doing this training in Baltimore and also in the DC area with pastors because I have gotten a lot of information from pastors saying our suicide rates are high, our burnout rates are high. We don't have an opportunity to talk amongst ourselves about our own mental health issues. So I've done half of a training that really focuses on how to recognize signs and symptoms of mental illness in your congregation, but how to also get some reprieve yourselves as pastors on how to heal yourselves. So the training has gone really well, and I've worked with a lot of the Presbyterian in the Baltimore area, and they've now established a retreat where they all go away as pastors, bring in trainers like myself, bring in other facilitators to help them come up with other coping strategies, other health and wellness strategies, so that they can not only deal with the mental facets of the difficult jobs that they have, but also the physical challenges that they have with other issues that they don't get to deal with because they're on 24 hours a day. So I'd love to talk to you more about that, but there are opportunities out there where pastors are finding ways to heal themselves. So I just wanted to mention that.
Hi. Again, I'm Stephanie Madden-Smith with the American College Health Association. I'm just interested in partnering with anyone that wants to talk more about pipeline issues around mentoring. Our membership is cross-disciplinary, but we do have quite a bit of folks that are psychologists and psychiatrists, and the current president of the American College Health Association is a psychologist. So I think that when we talk about the health of the profession, pipeline is a big part of it, and we obviously have access to college students, but sometimes you don't know quite what road you want to take in life. And I think the undergraduate level is where we really need to really embrace people, quite frankly, even maybe high school. But just putting that to the side, one other thing I just wanted to mention, and this is just my Stephanie hat, as I've been working in nonprofits for a very long time, and it does concern me, the dependence we have on foundations or the government, and I'm looking for more people that are interested in looking at how social entrepreneurship can help sustain our efforts. If a lot of folks, like Ms. Torres mentioned earlier, if 70% of people with disabilities are unemployed, if many people in the communities we're talking about are depressed but also living in an area that has low economic opportunity and mobility, maybe there are ways we can have sustainable enterprises focus on addressing mental health while also putting money in people's pocket and sustaining what we're doing, so that we're not always chasing uninformed funders support or the government. And I know that there are small instances where there's a bakery where I'm from that is fully populated and staffed by folks with mental and physical disabilities, but these are often one-offs. If there was something more integrated and maybe at a regional or even a national scaling, I think that it won't eliminate the need for foundations or federal funds, but it really does concern me how many do-gooders are often riding a wave of dependency because they're not integrating some type of sustainable economic model into what they're doing.
Terrific. Thank you. Excellent observation. So this will close our town hall portion. I'm going to turn it back over to Tiffany, but thank you again for all that you're doing, and I look forward to being able to work with all of you going forward to address our community's needs. Thank you.